Hey y'all, Azim here. We are going to take a look at histology of the respiratory system. Let's start with the upper respiratory tract. So when we breathe in, let's say through our nose, we first go into the nasal cavity. And in the nasal cavity, at the very lining of it, you've got non-keratinized stratified squamous, like at any opening of your body, like your mouth or your anus, for protection. But as soon as we go deeper, it'll transition to pseudostratified columnar. We are looking at nasal epithelium right now. We've seen this before because we looked at this with the senses. When you use your nose to breathe, you're also smelling. We're at 40x right now. We see all of this high surface area, all this convoluted tissue here. That's to maximize surface area for smelling, for conditioning air, for filtering air, for humidifying air. You want to have that increased surface area. You also see this darker staining thing here in the middle. That's hyaline cartilage. We'll be able to tell more clearly when we get closer, but you have hyaline cartilage in your nose. So let's take a closer look. This is 100x now. You can see that the hyaline cartilage is a lot more clear now. Let's look at the apical side over here facing the lumen. Let's go a little bit closer, 400x. All right, you'll notice that at the apical side, some cells are much longer, like this cell here. If you see a long cell that's spanning nearly the whole length of this epithelial layer, that's an olfactory sensory cell. That's a bipolar neuron. It's not a epithelial cell, it's a neuron. And its axons extend into this layer, and you can see some axon bundles here. All of this tissue here, these are axons of the olfactory nerve going to the olfactory bulb. Where we see the rest of these cells, most of them are supporting cells and basal cells. So most of these smaller rectangular ones, or the ones at the very base here, they're supporting cells or basal cells. They're classified as pseudostratified columnar. Occasionally you'll see, so these are, I believe, kind of looks like blood vessels. But sometimes you'll see these glands right here, see these simple cuboidal tubes. These simple cuboidal tubes are glands, submucosal glands in the submucosa. That's below the mucous membrane of this tissue. So that's the nasal epithelium for smelling, for conditioning air. You can find pseudostratified columnar as well as olfactory special neurons for olfactory sensory neurons. When we breathe, it then goes down to the pharynx. The pharynx is stratified squamous, non-keratinized. Then we have to make the decision between having stuff go down to our esophagus, which is also stratified squamous, or down to the larynx and trachea. The decision can be helped by a flap of tissue, mostly elastic cartilage, called the epiglottis. And here's the epiglottis, a section of that. In the middle, towards the middle, we can see this darker stuff here. That is the elastic cartilage. That was 40x. Let's go to 100x. You can see that there's fat here in the middle. But this tissue right here, where the arrow is, that is elastic cartilage. Let's go to 400x. Elastic cartilage, if you recall, has fibers that are visible, the elastic fibers that are visible, and they branch a lot. So they're interspersed all in between the lacunae of the chondrocytes. It is, if you go to the epithelial layer, you do see a simple squamous, but go deep to that, go deep to the areolar, and you'll find the elastic tissue, elastic cartilage, I should say, elastic cartilage. This is the epiglottis. It covers up the esophagus, it covers up the larynx when you try to swallow. So this epiglottis needs to be open if you're to breathe in. After we go through the epiglottis, after the air goes through the epiglottis, we make it down to the larynx and the trachea. The larynx and trachea, like the nasal epithelium, we go back to pseudostratified columnar. This slide has both the esophagus and trachea. We know that, I can tell you immediately that this one down here is the trachea because it's large, it's propped open by cartilage. We always want our airways open. This esophagus is more muscular. The trachea also has muscle, but this one's more muscular, and it collapses because there's nothing to prop it open. We always want our airways open. This layer right here, that's hyaline cartilage. Let's go closer. That was 40x. Here's 100x. You can see the cartilage a lot better, hyaline cartilage, and here's that pseudostratified columnar epithelium. It's ciliated, so it's pseudostratified ciliated columnar epithelium. Going to 400x, you can better see the cilia of the pseudostratified ciliated columnar epithelium. You can see that the nuclei are at different levels. You can even see some glands that are just below this mucus layer, the mucous membrane. And these are blood vessels. Some arrangements of cells that can form glands. And then deep to that, you've got hyaline cartilage, and deep to that, you've got an adventitia layer. Adventitia is just dense irregular. Just like what we saw with blood vessels, the tunica externa, also called adventitia. It's just a protective, dense, irregular layer. So that's the trachea. After we breathe, after air goes through the trachea, it branches to bronchi, which is very similar to the trachea, and it even has some cartilage. Then bronchioles, which has similar layers, has smooth muscle, and the more proximal ones have cartilage. The distal ones, the respiratory bronchioles, don't have cartilage. We then eventually get to actual lung tissue, which is made of simple squamous, which makes up the alveoli. So all these air sacs that you see, these are alveoli, singular alveolus. So here's a single alveolus. For air to get into each alveoli, these more open spaces, those are ducts. These are alveolar ducts. So we pass through bronchi to bronchioles to ducts, and then we terminate here at the alveoli. And that's where gas exchange happens. The type of epithelium you see here, that's simple squamous. We need thin cells to allow for gas, simple, quick gas diffusion. That was 100x, now we're at 400x. You can more clearly see these simple squamous cells. Very, very thin, flat cells. You can see the nucleus, like right here. Here's a nucleus. There are blood vessels surrounding them too, because you want to have the gas exchange with the blood. So here's a blood vessel. This is a larger one, but there should be capillaries, like capillaries just surrounding each alveolus. Some cells, most of the cells you see, the super thin flat ones, those are called type 1 alveolar cells. Type 1 alveolar cells are just there for quick gas exchange, thin and flat. But some cells in these alveoli are a little bit bigger, like this one here. That's a type 2 alveolar cell. Type 2 alveolar cells, they're not meant for gas exchange. They produce something called, or a chemical type called a surfactant. A surfactant is a surface acting agent. It helps reduce surface tension. And for a reason that we can discuss later, it helps equalize pressure in your alveoli so that you can easily get air in. If you didn't have surfactant, it would be very hard to breathe. That's the short of it. So type 2 cells, larger, less prevalent. Type 1 cells, the thin, flat ones, simple squamous, more prevalent. Here's a good example of a smaller blood vessel, a capillary like right here, or this space right here surrounding the alveoli. We want quick gas exchange between this airspace, this lumen space of the digestive tract, and blood vessels. All right. A little dusty here. That's in a nutshell, how air passes through our respiratory tract of the histology that we have. We don't have bronchioles or bronchi. But what we do have are two more slides of the lung, and they're showing special conditions. Special, not in a good way. This slide is showing a lung carcinoma. Hopefully you can just, here, we're at 40x right now. This is a lung carcinoma. Here's a normal lung. Normal lung, nice wide open alveoli, very branched, very easy to see. But when we get to lung carcinoma, we've got growths. Carcinoma means that there's cancer. We have growths that are impeding on the lung tissue. There are different types of carcinoma. I'm not an expert in carcinomas, so I am actually unfamiliar what type this is. If someone knows, please let me know. But we can see at the very least all that space that we had in a normal lung is not here anymore. It's been infiltrated, going to 400x now, it's been infiltrated with tumor, with cancerous cells. This is, again, a slide with carcinoma. That's a blood vessel. This is a slide with, you can see here, this is the border of what should be an alveolus, this line right here, but it's filled with other cells. The cell lining is thicker than normal. Yeah, that's lung carcinoma. Last histology slide I have relating to the lungs, this is pulmonary emphysema. With pulmonary emphysema, what happens is that you have scarring in the alveoli. The alveoli get damaged. They get stretched out and develop scarring. And so the alveoli may appear a little wider in some cases, but also not very thin. You can take a look at like this one here or this one here. It looks all jagged. That obviously is not what we saw originally. This is 40x. This is 100x. (400x). You can see the fibrosis here, the scarring, developing connective tissue because of the damage. It's pulmonary emphysema, scarring of the alveoli. All right, those are different parts of the respiratory tract and some lung conditions. Please let me know if you have any questions. Thanks for watching. Take care.